Hello guys, welcome back to Medico Days. So in this video, we'll be discussing all the 200 questions which came in Neetpg 2025. If at all there are any queries, please do mention in the comment box or please text me in Telegram. We'll be compiling it again if there are anything wrong. So first question, IBQ of a parasite egg. Answer is Enterobius vermicularis. Next, pedigree with mother giving disease to all her children but father doesn't give to his children. Answer is Kernseer. Next, thyroid carcinoma with TTF synaptophysin positive and amyloid positive. Answer is medullary. Next, patient with TB like symptoms after travel history with microscopic image. Answer histoplasmosis. Next, image of granuloma with giant cell containing stellate inclusion. Answer sarcoidosis. Next, a very tall man had problems with vision. When he went to ophthalmologist, he was diagnosed with ectopia lentis. Gene affected is fibrillin. Next, anti-SCL70 most commonly associated with ILD. Next, group A streptococcus is the main reason for bacterial pharyngitis in school-going children. Which of the following is mainly responsible for attachment of fibronectin to epithelial lining of pharynx? Answer is lipotecoic acid. Next, investigation of choice for CLL. Answer is flow cytometry. Next, follicular lymphoma pathology is T1418. Next, IBQ of a faggot cell. Answer is AML-M3. Next, caspases are used in. Answer pyroptosis and apoptosis. Next, image of a sinus with a swelling. Answer is septate hyphae with 4 to 5 micron width. Next, dermatitis hyperiformis with history of gluten sensitivity. Answer is celiac disease. Next, identify the mosquito from the image and the larva having no siphon tube. Answer is Anopheles. Next, seminoma histopathology image was given. Answer lymphocyte infiltration. Next, hexosaminidase deficiency is seen in. Answer GM2 accumulation. Next, a man contracting diarrhea after intake of milk products. Organism was gram negative and history of his son being a farmer. Answer Campylobacter jejuni. Next, retraction balls in biopsy following RTA. Answer is diffuse axonal injury. Next, a sewage worker with jaundice and hemorrhage. Answer is Weil's disease. Next one, painful vesicular ulcer around the mouth, multinucleated giant cells and intranuclear inclusions. Diagnosis is herpes. Next, drug for prophylaxis of meningitis. Answer is rifampicin. Next, history of anemia and MCHC increase. History of same in father also. Answer is hereditary spherocytosis. Next, Antony A and Antony B bodies are seen in. Answer schwannoma. Next question, positive birefringent rhomboid shaped crystals are seen in. Answer pseudo-gout. Next is an image based question. Answer is meningioma. Next one, gross image of an ovarian tumor. Answer is serous cystadenoma. Next, brain image with hemorrhage. So this one is about meningococcus with Neisseria meningitidis. Next, McFadden reaction is to identify. Answer Bacillus anthracis. Next, benralizumab is related to. Answer interleukin 5. Next question, filamentous gram positive Zn stain positive organism. Answer is nocardia. So nocardia, there were two questions repeated, I guess. So in this case, you can use the question which was mentioned about diabetic polyneuropathy. There was a question related to diabetic polyneuropathy. So question number 31 we can include as that. So next question, IBQ of transitional epithelium. Answer is ureter. Next, image based question on circumferential burns was there. Next, post-menopausal bleeding history with an image. Answer is adenomyosis. Next, septate with dichotomous branching. Answer is aspergillus flavum. Next, OBG manure image. Answer is Lawson's manure. Next, hemocentrin-laden macrophages are seen in. Answer right heart failure. Next is a question on orange-colored tonsil. Answer is Stangios disease. Next question, image of anal fistula. Answer is intersphinctering. Next is a breast image staging and image based question. Answer T4D. Next, destruction of salivary glands and lacrimal glands by lymphocytes. Answer is Sjogren's. Next, 10 to 19 years and weekly iron and folic acid program dose. So weekly iron and folic acid program was for it was an older program and it was for 10 to 19 years, and in that we used to give 100 mg iron and 400 microgram folic acid. But in the anemia mukt para, that is 60 mg iron and 400 microgram folic acid. So if WIFs exactly was asked, then this is a little confusing question. If WIFs, then the answer should be 100 mg iron and 400 microgram folic acid. But current program has 60 mg iron plus 400 microgram folic acid. Next, rhinoderma image, it is due to deficiency of ocular manifestation, vitamin A. Next, corneal guttata, answer is fugue dystrophy. Next is an image based question, answer throttling. Next, diazepam, answer is febrile seizures. Next, palpable gallbladder fever and pain, answer CA pancreas. Next was a question about hyperpigmentation due to, and answer is ACTH. Next was the nocardia question, and it was about paraffin bait technique. So one question was there about nocardia. Next one, question on acute stress disorder. And next one, Holman-Miller sign is seen in. Answer angiofibroma. Next, which vitamin deficiency will occur if ileum is resected? Answer vitamin B12. Next, a 25-year-old sustained femur fracture. 3 days later, he developed dyspnea and petechial hemorrhages. Answer is fat embolism. Next question, pegloticase mechanism of action. Answer converts uric acid to allantoin. Next question, In a surgery of duodenum, accidentally a vessel is injured and heavy bleeding occurs. Answer is IVC. Next, anesthetic agent related in malignant hypothermia. Answer is dandruline. Next is an image-based question. Answer is surgeon's knot. Next question, amiodarone mechanism of action. Answer, it blocks the potassium current. Next, garlicky odor is seen in. Answer, arsenic poisoning. Next, loading dose of Pritchard's regimen. Answer is 4 mg IM magnesium sulfate plus 10 mg IV. Next, Rene was positive on the right side and Weber's is lateralized to the left. Rene was negative on the left side. So answer here is left conductive hearing loss. Next is tics tardive dyskinesia. Answer is valbenazine. Next, Zasco phenomenon. Answer is tendon reflex after death. Next is a neck x-ray image based question. Answer is pyriform sinus. Next, lupus vulgaris is diagnosed by answer PCR. Next, Strasberg classification for bile duct injury. It's an image based question. Answer is type A. Next, a patient with HIV and TB. Management is anti-tubercular therapy for 2 weeks followed by ART. Next question, anal carcinoma lymph node related is superficial inguinal. Next, Nalgonda technique. Answer is alum and lime, bag A and D. Next, achalasia cardia, investigation of choice is manometry. Next question, hyponatremia, hyperkalemia, hyperpigmentation and salt craving. Answer is Addison's disease. Next is an image-based question of a lady with a swelling near the right eye. Answer is dermoid cyst. Next, mediolateral episiotomy repair. Answer is mucosa, muscle and skin. Next, isolated elevation of ALP in and change in head circumference. Answer is Page's disease. Next, image of a child with intestines in the chest cage x-ray. Answer is congenital diaphragmatic hernia. Next is de facto, it is present during remuneration. And next was a question about generation time. Then next question, pre-op and intra-op drug for pheochromocytoma. Answer is phenoxybenzamine. Next is an image-based question. Answer is Perthes disease. Next question, middle finger necrotic lesion with redness on the dorsal aspect of the hand. Answer is tenosynovitis. Next was to arrange in the sequence. Answer, randomization, manipulation, follow-up and assessment. Next is an image-based question. Answer is keratoconus. Next question, nerve supply to mylohyoid. Answer, nerve to mylohyoid, branch of inferior alveolar nerve and the facial nerve. Next, which amino acid will not be synthesized due to vitamin B12 deficiency in a patient with history of ileectomy with elevated homocysteine levels, increased methyl malonyl CoA and peripheral neuropathy. Answer, methionine. Next, anti-Mullerian hormone level is decreased in. Answer, premature ovarian failure. Next, a frameshift mutation occurs due to insertion of a new nucleotide at the 4th position of mRNA sequence with 900 nucleotides. Most likely outcome of this mutation. Answer, complete change in protein production. Next, lower limb swelling. Answer is lymphatic blockage. Next, Lias sign is seen in. Answer, carotid body tumor. Next question, carpopedal spasm is a complication of. Answer, thyroid surgery. Next, a patient is on insulin and on tab metformin. HbA1c is 8.3. Heart failure is present. Next medicine is empagliflozin, which is a SGLT2 inhibitor. Next is an image-based question. Answer, lower mandibular nerve. Next, which nerve does not contain GSC fibers? Answer, vagus. Next, hyponatremia, patient develops stroke. Next step is MRI. Next question, lateral root value of lateral cutaneous nerve. Answer, L2, L3. Next, acromegaly confirmatory test is IgG1 failure of suppression of GH. Next, patient with CKD and anemia, drug to be given is erythropoietin or darbepoetin. Next, number of urban PHC, it was a calculation based question. Answer is 42. Next, child with visual disturbances and suprasellar mass present, wet keratin on HPE. Answer is craniopharyngioma. Next question, lab technique used to compare and quantify CD markers. Answer is flow cytometry. Next question, anti-mitochondrial antibody is positive in. Answer, primary biliary cirrhosis. Next, uterine prolapse management. Answer is push-up and retrograde filling of the bladder. Next, shoulder dystocia sequence of management. Answer is McRoberts, Rubin, Gaskin and Zavanelli maneuver. Next, amniotic band syndrome. Answer is Sheehan syndrome. Next, ECV and the baby develops fetal distress. Answer is rotate the baby to the original position and later do C-section. Next is a question on control cord traction. Next question, prevention of thrombosis in a female with BMI more than 35. Answer is low molecular weight heparin. Next is a uterine prolapse question, and ligament related is the cardinal ligament, which is also known as the McEnroe or the transverse ligament. Next, in day 21 to 25 menstrual cycle, answer is LH and FSH are decreased. Next question, patient with white dandruff-like deposit on the anterior lens surface. Answer is pseudo-exfoliation syndrome. Next, binocular single vision consists of. Answer, SMP and fusion. Next, true about orbital cellulitis. Answer is ethmoidal sinusitis is the most common etiology. Next question, most common causes squamous cell carcinoma in the base of the tongue. Answer is HPV. Next, persistent oral lesions in 6 months. History of GRD on spicy food. Which drug? Answer is beta blockers. Next, a 70-year-old man with chronic back pain which worsens during morning and associated anterior uveitis. Investigation of choice is MRI. Next, a man with shoulder pain during extension. On examination, a tear on the long head of triceps is present. It originates from. Answer, infraglenoid tubercle. Next, a 25-year-old with fracture of the left tibia, severe pain and worsens with dorsiflexion. Peripheral pulses are present. Sensations are lost. Management is immediate fasciotomy. Next question, knee replacement surgery was done for a patient after 7 days. He presents with dyspnea and tachycardia. Investigation of choice is CTPA. Next, diabetic patient with COVID-19 dies in the hospital. Which type of surveillance? Answer is passive. Next, a study compares mean hemoglobin of two independent groups. Statistical test is unpaired t-test. Next, a 3-year-old with difficulty in walking and moving legs, underweight and less sun exposure. Government scheme related is ICDS. Next, prevention of coronary artery disease. Recommended dietary cholesterol intake per day is 100 mg per 1000 kilocal. Next question, measure the degree of objective and target achievement in health program. Answer is evaluation. Next, community intervention to control sepsis. 20 PHCs were given standard care and 20 PHCs were given community-based intervention. Study design is cluster RCT is the answer. Next, in VQ graph, which points show pulmonary embolism? Image-based question. Answer point D. Next, a man when trekking to high altitude, most common acid-base abnormality is respiratory alkalosis. Next, Katori method for a 7-month-old child. Answer 1 Katori for 4 times a day. Next, a woman with atonic PPH after vaginal delivery, not responding to initial management. Next step is balloon tamponade. Next, a woman with fetal bradycardia and maternal tachycardia, and most appropriate immediate management is C-section. Next, how many vein and artery in a normal umbilical cord? 1 vein and 2 arteries. Answer. Next, a woman with breast tenderness present, linea nigra, bluish discoloration of cervix. Answer is probable pregnancy. Next, penetrating injury and unstable patient. Next step is answer explorative laparotomy. Next, a patient on medication came with renal stones. This is due to answer decreased calcium excretion. Next, a 2-year-old came with shocking after peanut ingestion. Management is answer chest compression. Next, postco is related to answer under age of 18. Next, a father was ill. Doctor said he can't be recovered by further management, but doctor wants to keep in ICU. Answer is keep the patient in ICU and intubate. Next, immature teratoma is positive for answer CA125. Next, breast cancer screening, early detection but increased mortality rate has not changed. Type of bias is lead time bias. Next, footballer with foot aversion, it is due to injury of anterior talofibular ligament injury. Next, Hurler syndrome deals with answer dermatan and keratin. Next, exclusion criteria for BBAM regimen is miliary TB. Next is a calculation based question, value of x is -2. Question number 141, what is the value of x? Answer is -2. Next, HIV load more than 1000 to prevent transmission to newborn. Answer nevirapine plus zidovudine for 12 weeks. Next, PDA is due to defect in which arch? Answer is 6. Next, a person eating jowar rice develops osteoporosis. Answer is fluoride supplement is given. Next, Butzlam image of a 10-year-old child shows intense bright blue white areas. Diagnosis is nevus depigmentis. Next, head station is -1. Cervical dilation is 8 cm. Management is LSES. Next, lower esophageal sphincter and gastric emptying is promoted by answer metoclopramide. Next, factor 9 deficiency gets better after giving vitamin K in which of the following conditions? Answer bile duct obstruction. Next is an image-based question. Answer is spondylolisthesis. Next, a child with fracture on the leg with trivial trauma and splaying of metaphysis. Etiology is vitamin D deficiency. Next is an image-based question with central stellate scar. Answer is focal nodal hyperplasia. Next, a woman with migraine was started on sumatriptan. She had family history of coronary artery disease. Appropriate drug for migraine prophylaxis is propranolol. Next, common in C5 to C9. Answer is Neisseria. Next, patient presents with xanthoma, increased cholesterol, LDL is high, triglyceride was normal. There's history of death of father due to MI. Answer hyperlipoproteinemia 2A. Next, a patient says when he sits down, he hears flapping sounds of birds' wings. He believes it to be a sign of God to him to move in a specific direction. Psychopathology present is delusional perception. Next, 35-year-old found wandering in another city by social worker, appears confused about his identity, cannot recall how he reached there. No signs of intoxication or head injury, unable to provide personal information. Diagnosis is dissociative fugue. Next, Mr. K is rigid, overly focused on rules and order and perfectionist. He submits his work late and is focused on perfection. Most likely personality disorder is OCPD. Next, during surgery, here it is OCPD. And next, during surgery, a muscle relaxant administered to a patient led to facial flushing and hypotension due to answer atracurium. Next, MCU is used for, is an image-based question. VUR is answer. Following a building collapse, a patient with airway obstruction undergoes a procedure in image. True about it is answer, it will be followed by tracheostomy. Next, identify the type of suturing material image. PDS was given, answer monofilament. Next, true about varicose vein. Answer is it can progress to eczema and ulceration. Next question with normal thyroid intake uptake. Answer is iron deficiency. Next, blood sugar level was raised 2 to 3 times. Then it stays elevated for a constant period. Correct about it is first it rises, then sustained increased level. Next, based on VM, which vials can be used? Answer 1 and 2. Next, 30-year-old man with bronchial asthma, currently on salbutamol and ipratropium inhalers. She reports nocturnal symptoms including wheezing, breathlessness, which wake her up several times in a week. Appropriate next step is add LABA and inhale corticosteroids. Next, patient with DKA, not a part of initial management, is IV 3% NaCl. Next, best method to PCR method to diagnose organism causing meningitis, multiplex PCR. Next, 46-year-old woman with 16 mm endometrial thickening on TVS. Next step is endometrial biopsy. Next, 65-year-old postmenopausal woman presented with bloodstained vaginal discharge, BP 170/100. Next step is pelvic examination, pap smear and TVS is answer. Next question, pregnant lady presents in first trimester. She has toxoplasmosis 5 years back and IgG is positive. What advice is given? Answer, safe to continue the pregnancy. Next, prolactin will cause amenorrhea due to answer decreased GnRH. Next, a 23-year-old woman comes to OPD. She does not remember LMP. Best method to calculate POG is CRL. Next, NST is being done for a patient who presented with decreased fetal fetal movements. NST shows 1 acceleration in 2 minutes. Next step is continue NST till 40 minutes. Next, patient with marked high plasma phenylalanine levels, low tyrosine levels, phenylalanine hydroxylase enzyme assay is normal. Deficiency is which is likely to be responsible here. Answer is biopterin. Next, a 36-year-old woman with symmetrical small joint arthritis is positive for anti-CCP antibodies. Histological finding most characteristic is Spanish formation. Next, patient presents sudden onset weakness and aphasia for 2 hours. Pulse is irregular. CT is normal. Next step is start TPA. 45-year-old female with history of PND, palpitation, breathlessness, irregular pulse, tender hepatomegaly, heaving apex, diastolic murmur at apex. Patient has history of acute traumatic fever in past. Answer is pre-systolic accentuation of MDM. Next, 60-year-old patient with AF and aphasia and weakness. Next step is TEE. Next, sodium 130, chloride 84, bicarb 16, anion gap is 30. Next question, a 60-year-old man with long-standing COPD, presence with dyspnea, pH 7.32, PaCO2 60, bicarb 30, acid-based disorders, chronic respiratory acidosis. Next, 48-year-old man with ARDS due to COVID-19 is on mechanical ventilation. Which ventilator strategy? Answer, high PEEP and low tidal volume. Next, 34-year-old man, female, presence with right upper limb weakness, 3 months, marked atrophy of right deltoid and biceps and fasciculations and hypotonia. Deep tendon reflexes are absent in the right upper limb with intact sensation. Site of lesion is anterior horn cells in the cervical spinal cord. Next, 55-year-old man on long-term hydrochlorothiazide for hypertension, presence with progressive symmetrical distal paresthesia, weakness and signs of heart failure. Examination reveals decreased vibrations and position sense. Nutrient deficiency is vitamin B1. Next, a hospitalized patient was administered IVF, after which he developed hypochloremic metabolic acidosis. Fluid responsible is normal saline. Next, 38-year-old woman, presence with alt craving, generalized hyperpigmentation, hyperkalemia, metabolic acidosis. Diagnosis is Addison's disease. Next is the chest X-ray question. Answer, this is a confusing question. Answer could be lung collapse, lung consolidation, or lung abscess. Next, atrial fibrillation, initial management, verapamil. Next, in submandibular gland resection, which structure can be affected? Answer, facial artery. Next, which nerve doesn't pass through the marked foramen? Answer, hypoglossal. Next, 60-year-old patient with epistaxis, non-hypertensive, packing unsuccessful, artery ligated is sphenopalatine. Next, a patient presents with displaced nasal bone fracture. Instrument used for nasal bone reduction, Walsham forceps. Next, 25-year-old with ear discharge episodes and decreased hearing, best treatment, myringoplasty. Next, there was a question on sarcomia, and there was a question on total laryngectomy. Next, there is a leak of toxic fumes from factory. What should civilians do? Answer, close all windows and cracks in home. Next, clinical scenario of xeroderma pigmentosa was given. DNA repair pathway affected is nucleotide excision repair. Next, 16-year-old gave consent for sexual intercourse. Answer, girl's consent is not valid as she is less than 18 years. Next, man assaulted by his colleague, and upon being caught, Man assaulted his colleague, and upon being caught, he claimed that he heard his boss telling him that his colleague is going to kill him, and so he attacked in self-defense. Next step is refer him to a psychiatrist for comprehensive evaluation of the mental state. Next, man survived without food for 5 days. Primary energy source for brain during starvation. Answer is ketosis. Next, guys, there was I heard that there was a question about a mass on CT, but I don't know if it was there or not. I think all the 200 questions are authentically covered in this video, but if you have any queries, please let me know so that I'll be able to compile it properly, and then finally I can make the PDF which is fully correct. So that's it, guys. Till I come back with my new video, stay tuned. Till then, bye.